Alright, you left tune in. This is your mother witch nurse Zane. Now I'm giving you a simple but common questions in the board examination regarding to the medication timing and abbreviations. So here are the common abbreviations I hope you're gonna have to remember. So first one is AC antecedum. You have to take it before meals. So when you say before meals, you don't have anything in your stomach. Somehow it's empty stomach. So it's the same with your SF at the bottom, which is take without food. Most of the time, that client having that order, this drug is your serosulfate, commonly being given to the mother who is on the second trimester. Second, hindi siya pwede on the first trimester because of the organogenesis, and continuously given after giving birth 30 days or 1 month. Now, for the reason that the mother planned during that time, so you got your ferrous sulfate. So now this ferrous sulfate, be careful because it should be remember that the drug should be given without food. Why without the food, nursing? Because the drug can be easily absorbed once the environment in the stomach is acidic. And you know that there's hydrochloric acid in the stomach. And by means of digestion concept on your anatomy, 2 to 4 hours na digest ang sayang stomach. Kaya nga, 2 hours before meals, it's an empty stomach. Okay? Or without food. Then there's Zane. Is it related as well to the vitamin C, the ascorbic acid? Yes, synergistic effect. It will give a fast absorption because of the vitamin C. And the side effect of the iron therapy, constipation, diarrhea. I'll give her constipation. So all you just need to do is to increase the fluid intake, avoid eating meat, avoid eating non-fibrous food, so high fiber as well. That will be the diet. So post-sebum, it's after meals. So after meals, after you have eaten, the drug should be given. That's after meals. So these drugs are called your anti-inflammatory drugs, your SED, and your steroidal drugs, and your NSAIDs. So these drugs have pain medication mostly irritates the gastric area, leading to what's called peptic ulcer. So the cause of that is, yes, secondary due to the medication that is being given to the patient. Now, what's next? It's with food. Okay, with meals or with food. Mostly this is being given to a patient with pancreatitis. Having a pancreatic enzyme shall be given, the drug shall be given or sprinkled with meals. So it will be eaten together with the food that the patient is eating. Take with food or take at bedtime. Not take at bedtime. Common drugs for this, they are those drugs like anti-lipid medication. And that is your Lipitor, simvastatin, right? So these are drugs to decrease the cholesterol. Why at night, Najin? It's because that at night the client is what? The client's cholesterol is higher in the evening. So the doctor knows that it will be given at night to suppress the production of cholesterol. And remember that the cholesterol is less than 200 million per DL, correct? We do have the HDL and the LDL. The H is good, the LDL is bad cholesterol. And when you say a fatty food or saturated fatty food, when you say saturated, these are oil that has been taken from the plants. So unsaturated, this is an oil taken from the animals. So let's proceed to the next one. That is OD, once a day. So once a nilang siya binibigay, or it could be a vitamins or supplements, na? So twice a day, depende kung ano ang time ni dapat ibibigay. TID is tiered hindi, okay? That is 3 times a day. Kung when you say 3 times a day, 3 beses sa isang araw. So if you have to divide 24 divided by 3, it's every 8 hours. Take 4 times a day. That is the 4 times a day or every 4 hours. That's your round the clock. Your QID, your Q4H is every 6 hours. Kasi ang every 4 hours mo or 4 times a day mo sa isang araw, 4 na beses ka mabigay. So, 24 divided by 4 is 6. So, every 6 hours yan. Well, that 3 times a day, 3 beses isang araw, so 24 divided by 3, it's 8. So, 8 every 8 hours ang timing. So, at night, so yun na nga, we also have a drug for your condition called acromegaly. Okay? That drug, that condition acromegaly. So before we go to the acromegaly, what is that problem all about? That is increased production of the growth hormone below above 18 years old. No? Above 80 years? Okay. Above 18 years old. So, pero pag below 18 years old, pag matangkad siya, on his puberty, mo 7-footer na siya, that is giantism. Now, this medication, what do you call the medication to suppress the production of your growth hormone? The name of the drug is octreotide. Octreotide. Since octreotide binibigay siya at night, it's because, it inhibits the release of the growth hormones by the pituitary gland. Now, so this is what type of drug? Yes, okay. This could be your somatostatin analogs. The somatostatin analogs. Alright? So now, and if you will be not seeing the octreotide sa board exam, take note the drug is sandostatin. That is the first line medical therapy if surgery is not effective and feasible. Sandostatin. Okay, sandostatin. Now, okay, octreotide class, now ginamimik niya. So, ano ang route ng octreotide? Paano siya ibibigay? A. Oral. B. Subcutaneous. Yes, both subcutaneous and intramuscular octreotide can be administered. Okay? Can be administered. So as what I told you, somatostatin analogs are most common. Now let's proceed to the next one, which is take every morning. Okay. Drugs that are taken every morning. Why they're taking that every morning? What's the problem? Yes, it could be to give energy to the person's body. So, ano mga every morning na mga drugs? Levothyroxine, okay? There says levothyroxine is a drug for your hypothyroidism. It should be given in the morning before breakfast on an empty stomach then for an easy absorption. Right? So, another drug na diuretics binibigay in the morning because hindi pwede at night for the fact na magkakaroon na tayo ng nocturia. Ano pang drug ang binibigay? Yes, amphetamines, no? Amphetamines para maiwasan natin anemia. Amphetamines is the shabu, right? Methamphetamine yun. But the amphetamine is a drug for your ADHD. Ano pa ba dito? A drug taken in the evening. Okay, sabi ko na yun kanina. Drugs that are taken every evening, that's it. No? Every evening. So, meron tayong prolata, which is immediately. No? Immediately. So, these are your pain medication. No, not immediately. Prolata is when needed or as needed. No? A drug for a pain medication for fever. So, prolata yan sila. And for our stat medication, ano mga stat medication na pwede natin ibigay? Okay, the stat medication are your immediately epinephrine. You can use that especially if the patient has an emergency. So take note of that one for anaphylactic shock. I hope you have learned something for today's lecture.